My name is Shauna Leinbach. I'm a certified nurse midwife. I had always been interested in healthcare and had originally thought about going to medical school, but decided that the nursing philosophy was more what I wanted to do. So I had a varied career. I started in newborn intensive care. I worked on a trauma surgery floor, spent a couple years working with homeless people, and then became a public health nurse in maternal child health, and that's when I really became interested in maternity care. And then I actually just happened to find midwives accidentally for my own health care when I was still young and single, and really, really liked their philosophy of care. So sought them out for my care when I was pregnant and decided that's how I wanted to go with my career. You know, I love the relationships with my patients. I've been doing it for a long time. So women I took care of when I first started 24 years ago, their daughters come to me now, which makes me feel old, but it's still a pretty neat thing to have that continuity and to develop those relationships. Oh, I think it's hugely important. People aren't going to be open with you about their needs and their desires if there's not trust, and it can take time to build that. I'll often be with a patient and meet her 2 or 3 times before she'll often open up about what she really wants to ask, or even if it's someone I met at the first time, at the very end of the visit, that's when they ask the question they wanted to ask the whole time but didn't know if they could. So, and I think that's because they need to feel like they can trust you. I try to ask open questions. I try to be really non-judgmental in my approach. I mean, really, I've seen it all, I've heard it all. I try just really not to have judgment around things and meet people where they're at. I try as much as possible to respect natural processes. I try not to do a lot of interventions. I have an interest in alternative medicine as well, and have done a little bit of education in that. I'm still working on that. So I'm excited to maybe have some more avenues for that as well. I love to dance. I do a lot of dancing. I do gardening. I love to read. I'm in a couple of book clubs. I cook. I love to cook. So food and exercise, which is a good combination.